the lifestyle process. Supposing you are very tensed up, you have too much of load, you have to accomplish very fast thing, and you are loaded with all targets, everything, with tremendous stress. What happens? Your mind will get confused. Your normal objectivity and maturity will go away, and you start acting haphazardly. Same thing happens to the immune system. Immune system will get confused. Its subtle quality is going to reduce. Subtle quality to decipher who is the enemy, who is a friend, goes away. Therefore, what is to be done? What we do outside? We do radiation therapy. When the cancer cells are coming, we give radiation, we do chemotherapy and blast them out. If nothing happens, the tumors are growing, you cut them out through surgery. These are the three main modalities we have. But what we do here, we go to the immune system. Why immune system has become like that? Restore it. Then it will gobble up. How to do that? Reduce the stress level, change the lifestyle, and things will happen. This is what is going to happen. So we strengthen the immune system. For that we have a number of techniques that we have developed, which can be done lying down on the bed. It takes about half an hour. Pranic energization technique, mind sound resonance technique, mind imagery technique, mastering the emotion technique, all at the manomaya kosha level, to bring the manashakti and the bhavana shakti to strengthen the immune system. Vijnana sadhana kaushala, Vijnanamaya kosha, the power of knowledge and cognition transformation to be brought to do that. And Anam's Anandamrita Sinchara, to bring the Ananda to life. More and more happy. Our life should become happier. All our cancer patients are very happy, because their quality of life has shown improves quite a lot. Because they understand that we are not just this body, it is the wonderful Anandamaya kosha we are, and the Paramatman we are. That will strengthen, revitalize, things will start changing. So we started working to see whether really the immune system is going to improve. So we set up our lab, immune lab, and they started measuring. So in this study that we did, we published now 9 papers we have published, effect of integrated approach of yoga therapy on breast cancer, undergoing radiation, chemotherapy and surgery. What we have shown here is that the immune system strengthens itself. How? We measure the immune parameters. Natural killer cells will improve, cytokines will improve, all those things have the complete data I can show. Terminal cases, metastatic breast cancer, yoga and non-yoga, and then we went deeper to understand how the gene itself is changing. DNA repair mechanism is changing, and studies on apoptosis. Apoptosis means a programmed cell death. How the programmed cell death, which has to come up in the cancer cells, it crosses and it goes. So apoptotic index we measure. So that gives you a broad outline of how we are bringing up the health to deal with different diseases and to promote positive health and to move towards perfect health through yoga. And that takes us towards more and more happiness. And with that at the base, now we started this university in 2002, in which we have 5 divisions of Swami Vivekananda Yoga Anusandhana Samsthan. One is division of yoga spirituality, to understand greater and greater depth in our tradition. We have immense knowledge base in our tradition, but they have not been brought forth to the scientific level of understanding of the people. So what every student does is he has to go to the Shastras, he has to study in original Sanskrit and then try to bring about the specialities. And they have to do the experimentation. Both the best of the East and the best of the West, as Swami Vivekananda wanted. So yoga spirituality does intense study on all our Shastras, Prasthanatraya, Upanishads, the Bhagavad Gita, the Brahma Sutras, the main 3 texts. Then we have all the Vedic things will go. Hatha Yoga Pradipika, Yarand Samhita, all that we study, Yoga Vasishta, everything they are made to study. And then on the other side, at how to apply that to life sciences, how to apply it to physical sciences, how to bring that into the management scenario, how to bring it into humanities. All these things are being done with systematic research. So we have about 500 students and 50 PhD students and 100. And we have collaborations with the topmost universities of the world. University of California and San Francisco, we had a collaboration where we worked with HIV and diabetes. And we got an NIH grant for that. Then with the University of California, Los Angeles, and University of Southern California, we have the collaboration. At the University of Houston, in the MD Anderson Cancer Center, many of you may know that MD Anderson Cancer Center is the biggest cancer center in the world. They've got 1,700 oncologists in the hospital, full-time oncologists. 75,000 workers working there. Such a huge ocean. When you enter in, you don't know where you are going. And they got very fascinated with our result. When I presented that in Houston about 8 years back, they got fascinated, something very amazing. We want to see. Immediately within 6 months, their team was sent to Bangalore. And they came here, they looked at Bangalore Institute of Oncology and other things and collaboration, met a lot of cancer patients. They were convinced. Then we wrote out a MOU. And we applied for a good grant. And they said, well, all the work you have done is very interesting, but your problem is that you have done everything in India. And Indians believe yoga. Therefore, it might have worked. What about in America? Therefore, whatever we did, we wanted to replicate there. With the first grant, it's called as R28 grant. We got about $450,000. Then it is 3 years study. We have done. Whatever we have done here, the same results have come there, even better results there. We are wondering how it is better than what we do here in India. We investigated. One thing we have found is, one reason, in India, our patients say, sir, we are very happy, we are going to practice that 7 days a week without fail. But when you actually take data, we hardly do 1 day, 2 days, or 3 days, many days we miss. Whereas there, what they do is, no, we can't do it every day, sir, we'll do only 3 days a week. But the 3 days they do regularly. This is one good quality these people have found. Probably because of that regularity, the results are better that we have found. Now recently, we have proposed a much bigger study. Earlier we had our 2-arm study with 30 patients we took and measured. And because the results are very good, now we have proposed a bigger, what is called as the R01 grant, in which 300, 3-arm study, in multi-centered things in Houston. The satellite centers of MD Anderson Cancer Center, we are going to draw totally 900 patients, a 5-year study. And they have given a big grant of $4.5 million by the NIH. This is the biggest ever grant given for yoga and cancer in the world. So like that we have a lot of collaborations with different universities. Orlando, Hindu University of America, we have started. We are going to have a big conference September 24th, 25th, 26th of this year, wherein we draw all the people. And I invite all of you to come there. And this shows how the total approach of yoga, our traditional wisdom base, which had to be brought forth to the highest level of scientific research, is coming up. And using this, now we have taken up this project, to see that the curve which is going up like this in diabetes, can we start changing the trend? And in the next 10 years, 15 years, can we start bringing it down? This is our attempt to our country. Now, this we call as the Stop Diabetes Movement. And here in Bombay also we have started, and we have got our coordinator and others. And now we have got about 54 cities we have started. And this year we are going to start the 54 primary healthcare centers also we want to do. Nowadays, amazingly, diabetes has started going to the villages also. A lot of people have started coming in the village thing. Now we wanted to study that. So primary healthcare centers with Corona's Trust in about 8 states we are doing. And we want to see that the trend comes down. And Ravindra Acharya is our national coordinator. And those people who want to join hand, they can join this thing. This can be a very, very vital thing through which probably we could collaborate and take it further. And Prashanti Kutiram is a very scenic campus. And here we have got the tallest statue of Swami Vivekananda, 23 feet, which welcomes all the people who enter into our Swagat thing. And as you come here, we have the Gita Sandesha statue, Sri Krishna teaching this sublime wisdom to Arjuna. And then this is our little view of Prashanti Kutiram, a very scenic thing, yoga, the science of expansion of consciousness. And this is the Om building, which is the Holistic Systems Management Center that we have in Prashanti. And that gives you a broad outline. And thank you very much for inviting me to be with you all to share. Thank you.
Thank you, Guru.